Hello, this is Jeff Close-Up. I'm Carol Celine. My guest is Dr. Akhil Das. I was surprised when we talked earlier, Dr. Das, that you told me that you were a computer scientist before you became a doctor. What took you from the computer terminal into the examining room?
I've always been interested in technology and problem solving, and that's been part of my childhood as well as when I was growing up. So that's what led me to computer science. I was working in the computer science field for several years, and I was missing the people contact. And I thought I could take that problem solving skill and bring it to the examining room as well as the operating room.
You did something quite interesting. When you went to do your fellowship, your study after you finished medical school, instead of staying in the United States, you went to New Zealand. Why did you do that?
One of the major reasons that I went to New Zealand was try to get a better perspective of different medical care in different parts of the world and try to get a broader understanding of how medical care can be delivered. Second part was that they had this interesting laser technology that was developed in New Zealand, especially on prostate surgery, involving laser surgery. I was very interested in that, so we incorporated a fellowship out there in New Zealand. Plus, I love to travel.
I was going to say, that's not a bad reason. Did you see much of the world while you were there? Did you get to Australia?
We did. My wife and I went there, and we went to Australia. We went to toured all around New Zealand. We also went to a lot of the South Asian countries, such as Singapore and Thailand. So
very different life, isn't it?
It was a very different life.
You are the head of the female urology department at Jefferson. You're both at the Navy Yard and in Center City. And I would imagine that it's kind of hard to get women to talk about things like wetting their pants to a male doctor. How do you approach women and get them to open up?
I've always been very comfortable talking to people about their problems and issues, and empathetic as well as sympathetic. So I have a good ear for listening. And one of the first things I tell any woman who makes it to my office, I congratulate her by just coming out with the problem, because it's such a personal issue and it's difficult to get to the physician's office. So then congratulations are always in order. And that usually makes them feel much more comfortable.
I can't imagine any doctor who ever congratulated me when I entered the office. So I guess you were the guy in college that all the women came to with their problems?
Yes, I was.
So if I were to come into your office, what would be the problems that would bring me there?
Some of the common problems that we see is gotta go, can't get to the restroom type of issues, can't hold my urine long enough, or constantly leaking issues. Or some of the other problems we see is that can't get the urine out.
So it's I can or I want to.
Correct.
And that's if I'm a woman. How about for the men you see? What are the problems that bring men to your office? Because I know you also see men.
Right, and again, it's similar issues is that gotta go, can't get to the restroom, can't get the urine out. Some of the, since we have all this prostate surgery going on, there's a lot of issues associated with prostate surgery. After prostate surgery, some problems controlling their bladder. So we see a lot of men in that part.
So your area of specialty is continence.
Correct.
Or incontinence, depending. Does this affect people of all ages?
It does. I mean, you could see it in some children with some neurologic disorders, or and obviously adults from different various reasons.
Now, of course, as we said, your primary area is continence, and there are lots of new treatments today for these disorders. Could you talk about some of them, really high-tech stuff?
Some of the high-techs that are really interesting is in about the last 12 years or so, we've developed a pacemaker for the bladder, which controls the bladder better.
Like the kind they put in hearts?
Same company makes it, exactly. Same company makes it, and it's a neurostimulator, so we stimulate certain nerves that can help control the bladder better, especially for people who have an overactive bladder, can't hold their urine long enough. So those are specifically designed for that. Some of the other interesting things we're looking at is Botox injections into the bladder.
Botox? No, how does that work?
So Botox is basically deadens the nerves and reduces the urgency to urinate. So when we put Botox in the bladder, we actually inject into the back of the bladder, and it can be done in the office or sometimes an outpatient procedure. And patients have a less urgency, much better control, especially if you can't get to the restroom in time.
How long does it last?
Anywhere from 6 months to a year. So we actually have a trial going on at this time, and we're looking at it for people who have urinary incontinence from that.
Do you need to go under anesthesia to do it? To do the injections?
You can do it in the office without anesthesia.
Wow, that's just amazing. Anything else?
Some of the other interesting, I mean, obviously for women who have leakage issues, when they cough or sneeze, we have some interesting new technology, and we're getting the procedures becoming faster and less invasive. Things like slings and collagen injection, and they provide great relief for short periods of time.
Is this a problem for men and women equally? I mean, is it a large percentage of people who suffer from incontinence?
We tend to see more women with incontinence, but as more and more of this prostate stuff, prostate surgery that's going on, and as we're seeing an older population, we've seen both sides almost equally.
And we didn't talk too much about your personal life, but I know that you are a great cook. What's your signature dish? If I came to your house for dinner, what would you make for me?
So here's a little story, Carol. So my daughter was writing things for Thanksgiving, and she said, one of the things I'm thankful for is my dad's curry chicken. So I would say my signature dish is a curry chicken, and if it makes her happy, I think it obviously makes me happy.
Well, it's a lot easier than a turkey, I would think. Is there a secret ingredient?
Secret ingredient. It's a combination of all the Indian spices. Secret technique is when you put the spices in.
Ah, not all at once?
Not all at once.
Oh, okay. Well, I'm going to angle for an invitation for dinner.
Absolutely.
It's been a pleasure talking to you. Thank you, Dr. Das.
Thanks so much.